Hello, my name is Tana, and I am a nurse consultant with the California Bridge Program. I'm also currently practicing as a charge nurse in the ED. Today, we're going to talk about the Bridge Program and what we as nurses can do to advocate for our patients to receive the very best possible care that they can. First, I want to bring up a case. A 28-year-old male checks into the ED. He is a frequent user of heroin, and he complains of opioid withdrawal. He says, "I'm dope sick and I need help." Now, I want you to consider, what would his care look like if he checked into your facility? Would he get multiple rounds of medications, fluids? Would he get a workup? What would his length of stay be? And we'll come back and talk about him in a little bit. So addiction is not a moral failing. This is a chronic disease that requires medical treatment. Now let's talk about that a little bit more. This is a chronic condition. So similar to the way we approach diabetes or hypertension management, substance use disorders need to be treated from a longer term perspective, because that is how patients are most successful with treatment. With the detox methods, we see 80 to 90% relapse rates, and that's just not acceptable. We can do better. When we approach it from a longer term care perspective with medication for addiction treatment, we see mortality rates decreased by about 70%. We see decreased illicit drug use, decreased crime, decreased disease transmission. We see patients getting back quality of life, and that is so important. So the background for this is the significant rise in drug-related overdose deaths. In 2017, those death rates surpassed that of peak car crash deaths. And we've implemented all of these safety features in motor vehicles like seatbelts and airbags. So what are we doing to address all of these overdose-related deaths? Now, what we provide with medication for addiction treatment is a way for patients to feel normal again. Now, if you think about that patient that checked into the ED, when he first used, he went from feeling normal to that euphoric feeling and then returned to normal again. And then with subsequent uses, he had similar experiences. And then he got to a point where he built up a tolerance and a physical dependence to the drug. So now between uses, he actually goes into withdrawal, and he is using just to feel normal again. And then what we provide with medication is helping him feel normal and stable so that he can move forward and be successful in treatment. So the California Bridge Program is a grant-funded program that the goal is to provide high-quality, evidence-based treatment for substance use disorders in all of California hospitals. That way, when patients check in needing help, they are able to access the care that they need no matter where they check in. Now, let's delve into that a little bit further. These are the core values of the Bridge Program. First, we want to provide rapid evidence-based treatment. Patients are successful when they get treatment when they are there looking for it and needing it. So if a patient checks into the ED and is in withdrawal and he gets referred for follow-up for a week or two, that doesn't always work for patients. And if we can provide them with care right now and help them feel better, get them linked with care, they're going to be more successful. The other piece of that is a culture of respect. It is very easy to become jaded or judgmental. We label patients with terms such as junkie or drug seeker, and approaching substance use disorders with stigma like that actually creates barriers to care, and we don't want to do that. So we need to think about the way our language and our perspective of these disorders is affecting the care that we provide. Lastly, we want to make sure that patients are getting linked with follow-up care, linked with community resources and harm reduction education, because that is vital to them being successful. This is what we have seen so far with the Bridge Program. We have identified almost 10,000 patients with opioid use disorder, and many of those patients have been provided with treatment. That's a drug in the mouth, treatment provided right then and there that day that they're asking for it. Many have been provided with prescriptions, follow-up appointments, and this is really helping patients engage in care and be successful in treatment. So let's circle back to that patient that I brought up at the beginning. If he were to check into the ED that I practice at, he would be evaluated by a physician. He would receive a first dose of buprenorphine, also called bup. We would wait about an hour and see if his symptoms improved. As long as they did, he would receive a second dose to last him a longer period of time, and he would have a follow-up appointment the very next day. It is very simple and straightforward, and it works. It is so incredible as a nurse to see a patient check in. They are absolutely miserable. They look miserable. They tell you they're miserable, and we can provide them with something that works. They feel better, and they walk out of the ED grateful and hopeful that they have something that will work for them. So what can we do as nurses to help? First and foremost, we need to destigmatize opioid use disorder and substance use disorders. These are diseases that need medical treatment, and we need to advocate for our patients to get that treatment that they need. We also need to educate our patients on what to expect with treatment and educate our peers. We need our team on board with the same approach to treatment. Lastly, many facilities have substance use navigators, and they are a vital aspect to the team and can help patients navigate through the healthcare system to get the resources and help that they need to be successful in treatment. Thank you very much for your time. It is an honor to be a part of this program, and I'm very excited about all the work that we are doing. Please do not hesitate to reach out to me or access our website for additional resources. Thank you.